Hello, everyone. Good morning and good afternoon. On behalf of MSH, I would like to welcome you to our webinar on the quality of care that we have been putting together here at MSH. Thank you very much for coming. I think we can get started now. Next slide. So, on behalf of MSH, I just would like first to introduce myself. My name is Kara Endyke-Doran, and I am the lead for the Women, Children, and Adolescent Health team here at MSH, and I'm going to be moderating this session for you. Just a little bit of housekeeping. First, we'll go through a presentation for about 20 minutes or so, and then we'll have a question and answer session right after that. If you could put any of the questions you have in the chat box, we'll make sure to address them at the end of the webinar. Today we're going to be hearing from the USAID-funded Rwanda Health System Strengthening Project, and they're going to present an example of how we have institutionalized quality through a national accreditation program. This presentation will be given by my colleague in Rwanda, Joy Atuine. She is our Principal Technical Advisor for the Rwanda Health System Strengthening Project. For more than 45 years, MSH has worked closely with partners to expand access to services and improve quality of care and ensure that all people, even the poorest and most vulnerable, have had an opportunity for a healthy life. The Women, Children, and Adolescent Health team at MSH believes that safeguarding women, children, and adolescents' health is a core function of a robust and resilient health system, and it's a necessary condition for achieving universal health coverage. But we need to be looking beyond coverage. So here at MSH, we've really been looking at focusing on quality as a pillar of care. We know that these populations continue to die from preventable causes and face many barriers to equitable, high-quality health care. And this is why we've prioritized quality in our women, children, and adolescent health strategy. Next slide. So this is the second webinar in our quality of care series, which is, as we've titled it, an essential pillar to achieving universal health coverage for women, children, and adolescent health. During our previous webinar, we focused on quality of care in fragile settings, and we shared some experiences from the USAID-funded Integrated Health Project in the DRC. And today we're going to talk more about how we institutionalize quality through our programs in Rwanda. And really, the point of this webinar is to, share experiences and talk about lessons learned, but to continue the discussions around quality of care and really looking at how we can be more effective and efficient at providing quality of care throughout the health system. Next slide. As I mentioned, one of the strategic priorities for the Women, Children, and Adolescent Health team is to foster institutional changes so that health systems can consistently deliver high quality of care. Many of us on this call are familiar with the WHO's dimensions of quality, as you can see on this graph. And this is the definition that we use in our programs to ensure that systems are continually evaluating and striving to improve quality. Next slide. And MSH has worked with their local partners, civil society, and others to apply the strategic approach listed on this slide. So we have 6 main activities that we used in our practice to really foster this culture of quality improvement. And those range from building leadership in quality to ensuring that healthcare workers are adequately trained and supported, defining quality through standards, supporting evidence-informed quality improvement, strengthening the private sector health services, and advocating for supportive policies and guidelines at global, national, and subnational levels. Next slide. So today we're going to hear from my colleague, Joy. As I mentioned, Joy is the Principal Technical Advisor for the Rwanda Health System Strengthening Project. She has more than 18 years of experience specializing in health management, quality improvement, strategic planning, and project implementation. Joy has led and coordinated the team that developed Rwanda's most recent national treatment guidelines to standardize care for high risk, high volume, and common clinical conditions. She also led the team that developed the first set of Rwanda's accreditation hospital standards, which are now used by the Ministry of Health, its counterparts, and other partners. I'm very excited to pass the mic over to Joy to take us through the experience in Rwanda institutionalizing quality through their program. Joy?
Thank you, Kala. Appreciated. MSH is implementing a health system strengthening project. The project works closely with the Rwanda Ministry of Health to strengthen health systems from central level, provincial, district, and the community level. The project provides technical support in several strategic areas, that is health financing, leadership and governance, quality improvement, quality data for decision making, and increasing private sector engagement. Next slide. Rwanda Health System Strengthening Project supports Rwanda in its effort to achieve progress in all three universal health coverage dimensions: to increase financial protection, expand population coverage, and at the same time integrating quality efforts has been one of the key activities of the project, as this is critical for achieving universal health coverage and improving health outcomes. Next slide. Here are some of the promising results of the project, and these results have been part of the initiatives that the project has been supporting. A number of hospitals participating in the National Accreditation Program, 5 out of 43 are started with implementing standards, and now all the 43 hospitals are implementing the standards. 25 out of 43 hospitals have achieved level 1, and 4 hospitals out of 43 have achieved level 2, and this means that these hospitals are consistently implementing the standards that have been developed and the policies and procedures developed at level 1. Certain hospitals are seeing some improvements in certain health outcomes, e.g. like reduction of surgical site infection. Next slide. The RHHS project is supporting some initiatives and approaches to improve quality of services. Next. And before the introduction of the National Accreditation Body, here is the situation prior to the introduction of the accreditation program. There was low institutionalization of quality at all levels of the health facilities. There was no quality management unit at the level of the Ministry of Health. There was no policy and strategy for quality management to provide direction, and different projects piloted different approaches with no single integrated approach to quality improvement or to improve quality of health services. Next. Rwanda has developed a vision for quality care. The vision states that every Rwandan will consistently use quality health services that are easily accessible and meet international acceptable standards of care, and they directly respond to both the perceived and the actual needs of an individual. Next. In order to institutionalize quality of healthcare services in Rwanda, Rwanda has adopted a strategic framework that has helped the journey to institutionalize quality of services, and the project has focused on the inner triangle of the framework, that is the quality triangle, with regard to defining quality through setting of standards, measuring quality, and improving quality. More to that, the project has integrated and the existing PBF system to improve the rewarding for quality of healthcare. Next slide. It has been a long journey, but a journey that is worth pursuing. And starting with right from the beginning to establish the national accreditation body, it was very important to create an enabling environment for the accreditation program. And again, setting standards has been one of the key elements of the national accreditation program. These were developed based on the Joint Commission International Essential Standards. We appreciate their support. And further to that, down the road, there has been a process to develop the measurement mechanism that progressively measures the quality of healthcare services, and building capacity of trainers, of facilitators, surveyors, and that support the quality improvement teams. And with that, we have partnered with one of the Ministry of Health partners, Enable. We appreciate their support with regard to quality measurement and quality improvement to address the gaps. Next slide. It has been very, very important to create an enabling environment that creates an conducive environment to support the national accreditation program, and securing leadership commitment to continuous quality improvement has been very, very important. This has been done with support of the Ministry of Health, right from central level to facility level, and developing the national policy and strategy has provided the direction for quality management, and capacity building has been an important part of the process, where your capacity building has focused on training Rwandan surveyors. We have 69 certified Rwandan surveyors, and these help to assess or measure or monitor quality of services. And the facilitators, this is a group of professionals that support the facility teams to implement the standards and close the gaps that are identified during the survey. In the process, we have supported development and dissemination of the patient rights charter, and again we have supported the integration of existing PBF mechanism and the national accreditation program. This has been another good innovation that has strongly supported the process. In integrating the two, we have had several benefits, and it has helped us to separate the functions. Payment of incentives is done by the health financing unit and performance contracting, whereas the accreditation standards and continuous quality improvement to address gaps is under the clinical services. The integration of the two mechanisms has helped us to increase motivation of staff through the intrinsic and the extrinsic motivators. And at the same time, it has helped us to reduce the cost on repeated assessments by harmonizing the tools and integrating the teams that conduct the assessments. Next slide. In the process of institutionalizing quality, structures to govern quality are very, very important to support the strategy. And the Ministry of Health has really been very instrumental in this process to review their policies. At central level, they have created a unit that is responsible for health services and accreditation and quality, which is responsible for the oversight and coordination of quality activities at all levels. And again, the Ministry of Health is now strongly supporting the establishment of the new accreditation body within the country, which is underway. Further to that, at the facility level, the introduction of the quality improvement units and the review of the existing structure to incorporate quality improvement officers who are full-time is also another strong support to the program. And the hospitals at the level of the facilities, they have established quality improvement committees at the facility level, which are very instrumental to support the implementation of the program. Next slide. As I mentioned, setting standards has been one of the key components of the program, and this has been supported by GC, as I said. Our standards are organized in 5 areas, and these are the areas are leadership, process and accountability, competent and capable workforce, safe environment for both staffs and patients, clinical care of patients, improvement of quality and safety. Each domain has a set of standards. You can see that clinical care has more standards. Next slide. This is an example of one of the standards that is takes care of the reduction of healthcare-associated infection. And the standard has, in designing the standards, we have adopted a structure and process outcome systems approach developed in 3 levels of effort. So the standard has a progressive levels of to meet the standard requirements. Next slide. This is also another example of an assessment tool which is developed based on the standards and takes care of the different levels of the standards and has criteria for evaluation to make the assessment or quality measurement very objective. So in the process, the project has supported the management of the information system and has introduced an ODK tablet that is helping to manage the information system. Next. As I said, the core approach is a progressive approach, and these are the 3 levels of progressive achievement. The level 1, at level 1, hospitals focus on developing policies, procedures, protocols, plans, and putting in place committees, and these are at the initial level. Then as they complete that, they progress to implement the developed policies and procedures and protocols and guidelines. So in the implementation of that, then they proceed to level 3, where this time there's consistent improvement that is confirmed by data, and decisions to improve quality is informed by data, and continuously they strive to maintain what has been achieved at 3 levels through continuous quality improvement. Next slide. The graph here shows an example of one of the initiatives that the project has supported. It has designed and introduced a patient flow analysis tool that's used by the hospitals to be able to identify the bottlenecks to access for patients to access their ambulatory services, and this is creating a good culture of hospitals to be able to do their self-monitoring with regard to patient waiting time. So monitoring patient waiting time has direct impact on increasing access to services. And the example here shows is a baseline for one of the hospitals, and by using this tool, they were able to identify the waiting time, they were able to identify the staff contact time, and further to that, they develop strategic interventions to address the gaps and the issues that will lead them to reduce the patient waiting time. Next slide. Of course, quality cannot only be improved through measurement. So the core business of quality improvement is developing interventions to address the identified gaps during the surveys. And the project has provided technical assistance to improve quality of services and support teams to comply with standards through facilitation to develop quality improvement plans to respond to the identified gaps after the surveys, periodic surveys. And again, the project is using the root cause analysis, the problem solving, PDSA, or quality improvement methods to support teams work on their gaps to improve quality of services. Again, the project has supported development and standardization of healthcare policies, procedures, guidelines, and protocols. One of the important parts of this program has been capacity building and mentorship of teams and healthcare providers to be able to support the program and to have the knowledge and the skills required to implement the standards. Again, through the collaborative approach, we've been able to promote sharing of best practices and experience through peer learning, so that teams between hospitals pursuing this program are able to share their experiences and learn from each other. Next slide. Well, the results that we are going to share with you that have been part of the process. Next slide. Some of the results are performance improvement of hospitals. We have hospitals are performing at different paces, and we've managed to support hospitals to achieve level 1 of the accreditation process, right from the baseline in 2013 to date. And you can see that 25 hospitals out of 43 have achieved level 1 and maintained it. And again, even when they have not achieved the level, there is some progressive improvement that can be seen with the average performance score. Next. Part of the results is reducing surgical site infection. This is an example of one of the hospitals that has been able to reduce the surgical site infection in post-cesarean mothers. Right from the baseline in 2013, you can see that the infection rate was high, 8%. And in the process of implementing the standards and the technical support provided by the project, they have been able to reduce the surgical site infection. To date, they are at 2.9%, which is good. Of course, there are some ups and downs, but the trend shows progressive improvement. Next slide. While implementing the accreditation program, there has been challenges, and the challenges are hospital staff turnover. This has negatively impacted on the facility performance as it interlapses with the quality improvement support. And the other challenge is the infrastructure. Some hospitals have old buildings which pose constraints on quality and patient safety, and this is being addressed by introducing some standards that will be used right from the conception of major innovations and major rehabilitations of the facilities and new construction for safe health design standards. Another challenge has been training for critical areas. Some of the staff lack specific skills for some of the standards like resuscitation techniques, financial management, budget planning, and monitoring, which limits some of the achievements in for quality improvement or quality achievements. And this is also in plan as means available to strengthen the capacity building in some specific areas. Another challenge has been institutionalizing. Of course, institutionalizing takes time. The progress to establish an independent accreditation body to measure quality and avoid conflict of interest has been very slow, but most of the work to prepare the ground has been done, like developing the bylaws, proposing the structures, developing the policies and procedures that will govern the accreditation body. So, and this is something that is now taking off, and we hope that it will be supported to be fully functional, as it is an important component of the process. Next slide. In the process of implementing these innovations, we have learned lessons, and one of the learned lessons is that progressive accreditation creates a pathway for facilities to mature in their quality of care. Of course, ensuring the foundation for quality that is in place and catalyzing quality improvement efforts to achieve higher levels of performance. Another lesson learned is that engaging facility leaders is very important. Hospitals where leaders have owned and committed to the program are consistently performing very well. And another lesson learned is that introducing hospital standards has increased objectivity in surveying and assessing performance of health facilities. Another lesson learned is that reducing assessment frequency, the frequency of assessing facilities, gives ample time to facilities to work on their gaps and accelerate improvement. And again, it has demonstrated reduced cost of surveys. Another lesson that we have learned is that linking accreditation or integrating accreditation with the existing PBF mechanism has increased the motivation of staff participating in the quality improvement. Another lesson learned was that collaborative learning has created positive competition among facilities participating in the program and has maintained the quality improvement momentum. Finally, another lesson learned was that at the time of developing standards, it's very, very important to consider the national health goals, as this helps to really take care of national priorities and incorporate them into the developed standards. Next slide. Behind all this great work that has been done, there has been strong support of the Ministry of Health. We appreciate their ownership of the program. And again, there has been strong support of USAID. Without USAID, this would have been very difficult. And at the same time, we appreciate our partner support, Joint Commission International, at the time of developing standards. We appreciate Enable. This is a Ministry of Health partner who supports most of the surveys and some part of the quality improvement. So I will hand over to my colleague, Kara, who will be closing this presentation. Thank you.
Thank you, Joy. And just to come back to the beginning when we were talking about this intersection of UHC and quality, this is an example of how quality improvement and specifically an accreditation program can help advance UHC goals, thinking beyond coverage. The Rwanda Health System Strengthening Experience highlights how UHC must pay attention to quality if they want to translate these gains in access into actual health outcomes. And we saw that through some of the reductions in the cervical post-cervical infection rates, and then even looking at the patient waiting times. Joy was great in sharing their approach to establishing a pathway to institutionalize quality, really sharing that accreditation journey that they had throughout the program. And thinking back on it too, the National Accreditation Program allows Rwanda to govern health service delivery against standard metrics, aligning with the patient's charter, incentivizing through PBF, and supported by a process for quality improvement and timely data and analytical tools. This enabled the ministry to keep quality of care, patient experience, and service responsiveness at the center of the health sector's journey to universal health coverage. And again, bringing it back to some of our strategic approaches within the Women, Children, and Adolescent Health team, this is an example of how we're using that whole systems approach, how we're working along the continuum. It's not just accreditation, but it's going throughout the whole process. Next slide. I really want to now open this up to the floor, and please type your questions in the chat box. We have a couple of questions that have already come in, and I will read them to the presenters and give them a chance to respond. The first question we have is from Ados May. She asks, there are 43 hospitals participating in the accreditation program. How many hospitals are there not reached by the current program? Joy?
All hospitals, we have 46 hospitals and 43 are participating in the program. So only 3 hospitals that have received standards but are not yet fully into the program, and these are some of the hospitals that need some specific standards like the psychiatric, like the orthopedic standards. So they are partly implementing the standards, but they need a full package of those specific standards.
Okay, great. We have another question that came in. Is there a mechanism for continuous monitoring of quality?
Of course, there is a mechanism of continuing monitoring of quality. If I refer to the presentation, the self-monitoring of hospitals to monitor their patient waiting time, that's monitoring quality. The self-assessments that are done before the external assessment is done is monitoring quality at the level of the health facilities. And at the same time, the monitoring of quality indicators periodically is also another way of monitoring quality at the level of the health facilities before the external surveys come in.
So can you explain a little bit about the process of how the external evaluators come in to monitor that quality?
The external evaluators, right from the beginning of the program, the surveys were done every quarter. Then we moved to surveying the standard compliance every 6 months, and now we have shifted to annual to allow time for health facilities to work on their gaps. So in the monitoring and surveying of the standard compliance, they look at different levels to check whether facilities have really put in place the requirements for achieving standards at different levels. And at the end of the survey, they provide a score which is able to show how the level of compliance of each health facility.
There's a follow-up question to that from Wawira Munyi that says, how are hospitals held accountable when the standards are failing? So if they're not reaching those standards, how are they held accountable?
If they are not achieving their targets, they plan. The leaders of the health facilities, the Minister of Health meets with them to discuss the challenges they are facing with regard to meeting the standards. And if they are part of the challenges from the leadership of the health facilities, they pledge how they are going to improve. And if some of the challenges are supposed to be supported by the central level, then the central level tries to plan how they are going to support the facilities to improve, to meet their targets. So the accountability is at both levels, at the facility level and at the central level for resources and support.
Thanks, Joy. And another follow-up question to that was, are the evaluate the QI officers and the evaluators? Are they employed by the government? How are they funded?
Currently, they are not full-time surveyors, and I think this is not special for Rwanda. Even in other countries, surveyors come to do the survey as part-time. Normally, they are working in different institutions. We have like 10 that are working in the university teaching hospitals. We have 20 that are working in the district hospitals, provincial hospitals. So Rwanda, like any other country, we don't have full-time surveyors. The surveyors come when it is survey period. And they are facilitated. They are given some facilitation to be able to, in terms of per diem, to be able to conduct the surveys.
And that is funded through the project, the per diems?
Yes, this is through the Ministry of Health partners and from the Ministry of Health budget. So from the Ministry of Health budget, the budget from the partners, they jointly sponsor these surveys.
We have another question from Bistra Zaliva. She says, great presentation. Congrats on the outcomes. What was the government's engagement through the process? Who did you work with? What level of the Ministry of Health? And does the financing and PBF measures come through them? If not, did you engage with the Ministry of Finance?
Thank you. The engagement of the government has been very instrumental in the process, and the PBF, the unit that is responsible for the PBF at the beginning was conducting surveys, and it was the Ministry of Health that really was instrumental in integrating the two, so that we have one survey team and harmonize our tools, of course, for greater efficiency. And this has been an important role of the Ministry of Health to push this. Then the Ministry of Finance is works with the Ministry of Health to avail the PBF incentives, which is also very, very important. And this is the role of the of both ministries, Finance and Ministry of Health. And further to that, there has been a lot of support from the districts, of course, from the districts with regard to support of the PBF mechanisms.
Thanks, Joy. And just a reminder to everyone, please put your questions in the chat box, and we're going through them. We're getting lots of really great questions, so thank you so much. The next question looks into the private sector. Does the private sector participate in this program?
The private sector is the next step, but in the meantime, we have adopted the existing set of standards to develop a set of standards for private health facilities. Almost 90% of the standards that we are using with hospitals are the same standards that we'll be using, and 10% there has been a change because some of the standards were not relevant with the private health facilities. So very soon, in this year, we'll be conducting a baseline assessment based on the new set of standards for private health facilities.
Is there currently any system of regulation or standards for the private health system?
There are standards for licensing, and the ministry is using that, which our project has supported, licensing standards. And these are standards that are very important. They are basic standards They're using them for regulation, and we'll be we'll be reviewing these standards to incorporate more of the specific standards to strengthen the regulation role of the Ministry of Health.
The next question looks at this work in terms of the journey to self-reliance. So the question is, how do you look at this great work in terms of self-reliance of Rwanda's Ministry of Health to scale up and sustain this quality improvement approach in the medium and long term?
I think right from the design of this project, Ministry of Health has been involved, and partly from its budget, it sponsors this program, and again, it's one of the priority in the health sector strategic plan 4, which emphasizes how quality and accreditation is one of their priority. And again, if you look with regard to self-reliance, the 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 design of the program is using some resources like the surveyors, as I have said, that are not full time but are part time, that are working in other facilities, so that they are paid with other facilities and they can come to conduct surveys at a subsidized cost. And again, the move to the national accreditation program was the main objective was self-reliance, as it was very expensive to rely on the external firms. So this is very, very important to have the national accreditation program, which is designed within the means of the country.
So then, in follow-up to that, can you say a little bit more about the accreditation body? To whom is it accountable? Where does it get its mandates? For example, is it in the law, a policy, a professional association? Where is it located? Is it part of the Ministry of Health?
Thank you. The future accreditation body, which is underway, will not be part of the Ministry of Health, because the main objective of establishing an accreditation body which is independent and can make independent decision was to avoid conflict of interest, because the ministry cannot measure its performance, since the ministry is one of the oversees the providers, and the accreditation body is seen to be independent organization with a governance body that brings together multidisciplinary members and councils, professional councils, and other experts to support to govern the accreditation body. And this accreditation body, as it will be independent, this will be very important to make independent decision, but still it remains the role of the Ministry of Health, or the responsibility of the Ministry of Health, to regulate the quality of services. That means that even the accreditation body will work with strong collaboration with the Ministry of Health, because regulation of quality remains a mandate of the Ministry of Health.
Thanks, Joy. Another question that just came in is, did the project look at how has the quality improvement improved utilization rates of the health facilities? Have we looked at that at all?
There is a study planned to 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 be conducted and look at the utilization rate, but maybe what we can share with you, what the project has supported, most of the work supported with regard to health financing, has contributed to the increase of utilization of health services from 1 to 1.7 currently through the work that is done to support the community health insurance.
And I think we have time for maybe one more question. Here's a question that just came in. The focus of this program seems to be at the central and facility level. Are there any plans to incorporate quality improvement for healthcare at the primary healthcare or community level?
Yes, as I talk now, the standards, the primary healthcare standards have been developed and disseminated to all health centers, and the project has supported with the Ministry of Health together the training of more than 100 health professionals at the level of the district hospitals that will help the health centers to implement the standards. Again, through the regular supervisions of district hospitals, they will be supporting the health centers to meet the requirements of the primary health care standards. At the level of the community, as I said that this is a progressive approach, we will be the next level to how to develop the standards.
Great. So we still have a bunch of questions, which if you could move to the next slide. At first, we'd just like to thank everyone for joining and participating in this webinar. If you would like some more information, we have our contact information that's showing on the slide. We also are having this webinar as part of a series on quality of care, and you can subscribe to MSH's newsletter to find out more information about when the next webinar or live event will be. I will be showcasing some work that we may be doing in Kenya on leadership and development. So I would just like to say thank you once again for all your participation and for all of the questions. It was a really exciting opportunity to hear from the program in Rwanda and some really interesting questions for us to think about as we're working on this program. So thank you very much and have a wonderful day.
Thank you too.